According to the 2011 World Health Organization Global TB Report, Uganda is among the 22 high-burden countries in the world, with about 70,000 new TB cases every year. Half of these patients are HIV positive. In Kampala, the capital city of Uganda, about 10,000 cases are reported every year. Poorly treated cases lead to the development of complicated tuberculosis called multi-drug-resistant TB, which is now on a rise in the country with about 300 cases since 2008. To support already existing structures in the fight to stop tuberculosis in the country, USAID funded an 18-month project called TB Care 1 since January 2012. These are the stories of some of the patients who have been tracked, supported and put back on treatment in health centers closest to them over the last 1 year.
I started by having a sharp pain under my breast. I went to hospital. They got me an X-ray. They told me that I had water in my lungs. They said those were signs of TB and they gave me medicine. I restarted taking medicine in December because I had stopped taking it in February. When I stopped taking my medicine, I got so sick.
But at least these days we get some money for airtime, we call them and see how they are. And that's how I found Nabatanzi, because she had defaulted for more than 6 months. So when I called her, she said, the drugs, I rejected to the drugs, I'm not coming back. I said, you come back and we'll see. So when she came, she was in a bad condition. She was taken to Mulago, she was admitted, and they retreated her.
Shafiq lives with his grandmother and sometimes his mother. In the past 1 year, there has been a big improvement.
Since Shafiq started getting medicine, there has been a big difference. Previously, he couldn't walk up that hill, but now he's able to take himself to hospital. That is how much he has improved. He's now even eating. He wasn't eating before.
USAID, through the TB Care 1 project, has boosted Mulago Hospital's TB facilities with the renovation of a 39-bed-sitter ward. Soon, patients will be admitted here to avoid further spreading of the disease.
So actually, as patients come in, this will be their first room. We shall be admitting them in this room, which accommodates 6 patients. So as they come, you're supposed to admit them in this room first. Yeah. So we start them on treatment, and then when they convert, that is after something like 3 to 4 months, we shift them to the next room.
With new systems in place, providing services to TB patients has become more efficient and easier for the health workers.
When the patient comes in, the patient, after recording in the diary book, is also recorded in this diary. And when that patient comes back on that date, we put a tick that he has turned up. In case he has failed to turn up, that patient has missed treatment, missed appointment.
But since TB Care 1 came and brought for us airtime, we saw it's really, really inevitable for us to get the phone numbers of these clients because we called them. And when we started calling, we discovered many people had died and many are defaulted. just because at one moment there was a shortage of drugs. So it has really helped us a lot.
The most important message for a TB patient today is that TB is curable and TB is treatable. But as a patient, one must adhere to the treatment and complete the treatment. As a patient, one must present him or herself for follow-up examinations and take the advice of the health workers.